Yeah? Okay. Do give me a thumbs up so that I know you're hearing me.
Yes, ma'am.
Okay. All right. So happy to be here to conduct the session today. A very important topic, I would say, communication. I don't know how far you've come across in this course that you're doing right now, but I'd like to hear from you before I begin the whole session. How is it going so far? So if any one or two of you can speak up, that would be really nice. I can only see a few videos on, so I'm looking up to you. Just before I start any lecture session, I always like it when the sessions are more interactive because we get to learn from each other. So that is why I'd like to know how is it going so far? Where are you standing right now? So that when I conduct the session today, I know where to begin from and how to connect with you in the best manner. So do let me know how are you feeling right now, being here right now? Fine. We got a message saying fine. All right. If anyone else would like to say something, it's good, ma'am. Okay. All right. So I believe I feel that you're not in a mood or you're not warmed up enough to start talking. So I'll still do the talking for now. But hopefully, as we progress forward, I'll hear more from you. Yeah. So today we're going to do an introduction in communication. So let me just share the screen. Um, do give me the permission to share screen, okay?
I already gave you the permission, ma'am.
Okay, all right. Yes, are all of you able to see the screen right now?
Yes,
I'm
ma'am.
not able to see any participant right now, okay? So do respond. The screen is visible?
Yes, ma'am. Yes, ma'am.
All right, yes.
Yes,
So
ma'am.
now I'm using a slide which was already used before, but I found this quote very interesting. Okay, that says the single biggest problem in communication is the illusion that it has taken place. Yeah, I've read recently in a book that even as adults we behave like small children. Now, like when we have babies, when babies start crying, we make assumptions that maybe the baby is hungry, the baby needs milk, or we'll think okay the baby has passed motion or something, and we make such assumptions and we cater to the needs of the baby. Now that is because the baby is not able to speak or use verbal language like we adults do. But even as adults, if you look in our daily lives, we'll say statements like, "Oh, the person should have known what to do. The person should have understood." Even when I didn't say, the person should have understood what I felt. Yeah, we tend to say things like this, right? In our daily life, okay, it causes a lot of misunderstanding and fights and everything. But when it comes to this field of palliative care, when we are talking to people who are in such a vulnerable condition, we are in no position to make any such assumptions. Okay, so it is definitely a, a big alert for all of us to know the importance of communication. Yeah. So as we look into communication, like the major pointers for today, okay, today during the session, what I hope to cover is under these headings, okay, that is, who are we communicating to, like who are we speaking to? Like right now, as I'm in this session, my understanding is that you're all in this field, you're all doctors, or definitely engaged in this in a close circle with palliative medicine. Yeah, please correct me if I'm wrong in any way, okay? Please let me know. So that is my understanding. Okay, so that is my audience today. So in that basic sense, who are you talking to? Who are you communicating with? And what are you communicating? Like, okay, what is the person's situation? Okay, what is the person going through? Okay, you're giving medical terminologies. Okay, this is your condition. Okay, what can you expect? And how are we going to manage this? How are we going to help you? So in that sense, the what is also very important. But I would say the most important thing out of all of this is how you communicate it. Okay, no matter what you say, okay, the way you do it makes such a big difference. Okay, so these are like the major headings that we look into today. Okay, but before any of that begins, okay, why are we having this session right now? Let's begin with that. Okay, so uh, we are all, I believe we are all verbal people who can communicate with each other. We are able to express our needs. We are able to understand each other. We are able to respond accordingly. But why are we doing this introduction to communication session today? What is the whole difference? Can anyone say what is the difference between the normal typical sense of communication and what we are going to look at today or in the upcoming sessions? What do you think? What is the difference? Can any of you speak up? Like I said before, I can't see any of the participants right now. Okay, I'm just looking at my PPT, so I'm waiting to hear from you. So if any one or two of you can tell me why is communication going to be different in this particular session? Is anyone there?
Somebody please unmute yourself and respond.
Don't feel intimidated or threatened in any way. Okay, like I said before, I really want this to be more interactive. Okay, or else I won't know if you're able to understand what I'm saying. I mean, after all, I'm taking a session in communication, so the basic requirement is for me to understand that you are able to understand what I'm saying. Yeah, so please do respond. That is a humble request from my end. Even if your videos are off, that is totally fine. But please do respond by unmuting and speaking up, or you can use the chat box.
Relatives know the patient condition.
Yeah. So that is in this particular context, communication becomes important because
Nincy,
yeah.
we have received on our chat to gain patient trust.
Okay. When the chat comes, can you read it out for me?
Yes.
Yeah. All right. So what I was saying is, now, why are we having this session in the first place? That is because as you start interacting with patients or family members or even other healthcare professionals who are working in this field, they come from a very vulnerable state of mind. Okay, they are going through a very challenging situation. Okay, probably very troubled and emotionally in a very low state of mind, having a lot of questions and doubts and fears and everything. Okay, so it is not like the normal person you just randomly meet around you. Of course, everyone has their own problems, but in this particular setting, you need to be very much sensitive to what you are saying, how you are behaving around them, and how you're responding to what they're saying. Okay, so this whole session, we are going to look at how can you be more equipped in interacting with these people. Okay, now they'll come with a lot of questions. They'll have a lot of doubts. Okay, what am I going through? What can I expect? How long do I have? All such questions, While the questions might sound very clear, it may come from a lot of emotional turmoil. Okay, a lot of fear that is there within them. Okay, so in order to be able to uh, take care of that, okay, to be able to respond in a very empathetic manner, to address their concerns, whatever they ask, to be able to give them the right answer. Because in our societies, if you notice, a lot of people get misled, right? You have, let's say, we have a spinal cord injured person. Okay, so there will be people around them who you need to go to this person. I've heard that they have a good treatment, you'll be healed completely. And then the person goes there and spends a lot of money. Okay. And then in the end, it's just worse. Okay. So being misled in different ways, that is a very big risk. So to be able to give them the right information, and in that too in a very sensitive manner, not just being very factual like Wikipedia or anything, but to answer their questions with compassion, to provide them comfort and reassurance, giving that sort of an emotional support. All of this, it becomes very important in communication. Now, the questions we in the previous slide that we saw, who and what and how, in a sense, the why part is very much connected to all of this. Okay, who are we talking to? Okay, we'll have patients and families who are suffering. Okay, they're suffering in one or the other way, so we are talking to them. So the communication with them becomes very important. And what are you talking about? You're talking about serious illnesses, right? It's serious news, and very often maybe it may feel like bad news. Yeah, when you hear that, okay, you have this chronic condition and there is probably no cure, or you can just manage, there will be a lot of pain along with this condition, or you may even lose life. Okay, so all of this, it's like serious news, very challenging. So the what, that is also very much loaded. Yeah, so the way you communicate, that becomes very important. The how part, okay, that is, how can you tell someone that, okay, what you're going through, there will be a lot of pain and it may get worse over time. Okay, when you say this to a person, definitely it will affect them, right? So because of all of these reasons itself, the why, that is, why is communication very important, that becomes the more emphasized. I hope you're able to understand me. Okay, if at any point you feel confused, or if there are any doubts, if you feel like I'm going too fast, please let me know. Feel free to stop. I mean, pause. Okay. All right. So this is like, who are you communicating with? Like I said before, we have patients and their families. Okay. Everyone notices the patient, what they're going through. Maybe they're visibly, they have an issue. Okay. Or because of their pain, you understand that, okay, the person is in pain. But do not miss the person who's around them most of the time, the caregiver, okay, the family. Very often people notice the person who is ill. Every attention goes to that person. Yeah, like even when I go for counseling sessions with patients and their caregivers, when I ask questions like, are you getting good sleep? It is the patient that they talk about, okay? And then I'd ask the care, no, I am asking about you. Are you getting good sleep? How is your sleep? Okay. So then I make it a point to let them know that you are very important. We always give attention to the patient, but you are very important. So we are talking to people who are suffering in one or the other way. Okay, either suffering due to the illness, or the person who's closely attached to the person having the illness. Okay. So be sensitive about that. That is who you're talking to. And then the other professionals who are working with you. Okay, if you're a doctor, you're also in touch with the nurse and social workers and psychologists and everyone who's working together as a team. It is a team effort, no? So it is very important that you have clear communication with each other. Like, suppose I'm going for a session and I really don't know what the person's condition is. Okay, I know spinal cord injured, or let's say the person has been affected by stroke. Okay, but okay, how has it affected the person? Okay, what are the doctors saying? What is there? How does the prognosis look like? Okay, these are things that I need to know. Yeah, so as a team, you need to be sure that, okay, you're connected with each other and you're on the same page. And this is also a very important aspect of the communication. And apart from all of this, the general public, I just added it there because the the people outside the whole setting, they really don't know what palliative care is. Okay, or maybe they have a very vague and general idea of it. Okay, people who are about to die, or they have such cancer and such conditions. Okay, they stay there like in a hospice. Okay, they don't understand that in palliative care, it's not just about waiting for the person to, I mean, it is not about waiting for the person to die, but it is about uh, improving the quality of life. Okay, whatever life they have. Okay, even if it's towards death that they're moving to give them a very uh, life that is filled with dignity. Yeah, so the general public who come into contact with such interactions, okay, maybe it's the, let's say, the person who's providing transportation, okay, the taxi driver who's coming along with them, okay. So whoever is involved, make sure that your communication is clear enough so that they understand, okay, this is what is happening, okay. So that is just about the who part, okay. Do we have any questions so far? I'm just taking a moment so that I can hear if you have anything to ask or say. All right. So next we have the what to communicate. Okay. Now this is just the broad picture. Okay. But please be sure that you don't give all of this at once. Okay. You don't tell everything to the patient all at once. You take it at a pace that they are comfortable with. Okay. Be the first stage where the person has come in and you've had the initial conversation, and then you've done the let's say every procedure or test or everything, okay, that leads you to the diagnosis, okay. And in order to tell that to the person also, you need to be very, very gentle and patient about that. Okay, what does the person already know? Okay, you understand what does a person already know. Has the person met other people? Has the person been in touch with other doctors or any other professional who have already told them about something or the other? Okay, so you understand where they are, right at the beginning. Where are they standing right now? And based on that knowledge, that is where you slowly build up. Okay, would you like to know more? Is this a good time to tell you about it? Okay, you prepare them. Okay, you prepare them for what is coming up ahead. Like very often when people have something, let's say sad news or bad news. Okay, not in this context, in daily life setting. Okay, people say like, I have good news and bad news. Which do you want to hear first? What is the whole point of that question? Now, that question is asked so that you know, okay, there is some bad news coming. Okay, or a person before saying the bad news, they'll say, I have something, a bad news to share. Or today was a very bad day. Okay, you add a heading like an intro to what is coming, no? Why are we doing that? It is to prepare the other person that, okay, see, something bad is coming up. Okay, it might be hard to hear this. Okay, but this is coming. Okay, it's just one sentence, but that one sentence, it makes, okay, something is coming. Otherwise what happens, the person is not prepared, no, we're like at shock. Suddenly we hearing that, okay, oh no, this happened, like that, you'll be shocked. So to prepare the patient before what you're saying, going before you say something like that, okay. And then the next aspect, that is a treatment. Okay, what are the steps ahead, okay, to understand the situation of the patient, okay, the family, okay, what are they comfortable with, what can they afford, everything. You take all of this into consideration, and that's the treatment aspect of it. And then the, okay, what can you expect, okay, even when you do all of this, what is there up ahead, what is the usual scenario. Okay, so all of these concepts, this is like I said earlier, this is the broad picture, okay, what all you may have to say. Okay, but no matter what, remember one thing, that you cannot just put it all out there in one go. Okay, you look at the person who is opposite you, and depending on how they are right now, okay, that is how you take it forward, slowly at their pace. Okay, so what to communicate, that is again just giving you a guidelines on the basic stuff. Okay, and coming to the most important part, like I said, okay, the uh, who to communicate, yes, that will definitely, you'll understand one or the other way. You'll know that, okay, these people are involved in the whole situation. Okay, this is a patient and this is a family. You will anyway understand. Okay, if not at the beginning, slowly you'll understand. And what to communicate, yes, as you have more practice and experience, you will know, okay, this is a condition and this is what happens and this is that. The what part is also like, okay, textbook, let's say, and with experience, yes. But the how part, that is where you need to put in a lot of practice and effort, and that is what makes the whole process. whole process for you and for them better. Okay, it can go either ways. It can make it worse, or it can make it really uh, helpful also. So before saying how to do that, okay, how to communicate effectively, let's look at the main roadblocks here. Okay, why does communication become so hard? Okay, like when I try to do these group sessions, okay, with patients and caregivers. Okay, now one thing apart from counseling that I try to do is I try to use arts-based therapy, okay, to give them some time to express themselves, understand what they're going through, okay, to look at everything in a different perspective using arts, so that it becomes more, let's say, enjoyable. Okay, that's needn't be enjoyable always. It can just be a different experience. Okay, but what happens is that when I bring together all of these people, they might be in a very emotionally low state. Okay, like they're feeling really dull and sad. So I cannot ask them to, engage in a game or dance or song or anything, no? So over there, their emotional state of mind, that becomes uh, that becomes a challenge. Okay, but apart from that, when you're communicating with them, okay, uh, outside any sort of sessions, let's imagine you're just a normal person, a common man. Okay, when you try to communicate a person who's going through that kind of serious illness, what makes the communication hard? It is really hard to solve their problems, right? When they say I'm going through this and that and everything, you just feel so helpless. Okay, how do I respond to that? What is the best thing that I can say to the person? Very often you get stuck. Yeah, so there are several such barriers, or let's say things that make the whole process very challenging. Challenging to the extent that you will feel scared. Oh no, I don't want to talk to that person, or how do I deal with the person? Or I just want to be done with that. In that sense, you get those feelings. Okay, and that is very natural. Okay, that is when you get such feelings or such thoughts, it is part of the whole process. It should be difficult. Okay, and that is why we're exactly looking at these points, so that at a later point you'll understand, okay, now this may be blocking my way. So first of all, because all of you are professionals, let's look at the barriers in that context. Okay, that is, you're afraid of how the person will react to what you say. Okay, when you say that, okay, this is an advanced stage of cancer, okay, and there are no treatment options available, how would the patient react? Okay, now I said this so bluntly right now. This is not how we'll do it, but I'm just giving you an example. Okay, but if this is a fact of it, okay, this is what you have to tell the person, that this is an advanced stage of cancer and there are no treatment options. Okay, that is the essence of what you have to say. But you're so afraid. Okay, how will the person react, especially if the person has come in late? Okay, the whole diagnosis happened very late. Okay, so how will the person react? Okay, you're so afraid, and you'll be worried. Okay, how will I do this? How will I say this? Okay, that is like a major block. Yeah, and you get stuck. Okay, how do I say this? How do I put it there? You just want to get it done with. Okay, but for them, that makes a whole difference. Like, even recently, when I was in session, there was this wife whose husband was diagnosed with an advanced stage of cancer, and it was only towards, like, it was very recently that they came to know about all of this. And she was just crying. Okay, she was just sharing the whole thing with me, and she was crying that our life changed that night. That night when we came to know this, our life changed. Okay, and she's crying. Okay, so that is the impact of such a news for these people. At that moment, right at that moment, the whole life, their whole world, it will seem like it's collapsing. Okay, so uh, it's like you have so much of pressure on you. Okay, what you say, how you'll say it. Okay, so that is like a common barrier. Okay, not knowing what to say. Okay, how do I say this? And like in this example, when let's say it's very close, it's the person may die anytime. Okay, so there is not enough time. It's not like you can take it slowly. Okay, slowly, when the person is ready, I can say it. You may not have that option always. Okay, so that is also another challenge. Yeah, and definitely when we say these things, uh, they'll start putting a lot of criticism. They'll start blaming life. They'll start blaming the world around them. They'll even start blaming the medical professionals. okay, we went to this doctor before, but then they said nothing was wrong and everything. We couldn't identify that and everything. They'll start putting all that blame. It'll in one or the other way, it'll come towards us. Yeah. So all of these, why am I saying all of this? Now, I want all of you to know that this is there. Okay, it is there when you're going through, when you're having these kind of tension. Okay, like, okay, how do I say this? Okay, or what will happen when I say this? How will the person react? Okay, all of this is a part of the whole thing, but let it not stop you. Okay, let it not stop you. Yeah, and even we'll go through a lot of distress. Okay, especially when you're into the field and you have a lot of compassion towards these people. When you see them suffering, when you see them crying, even you will feel like crying. Okay, there is this shared distress that is there amidst you. Okay, so these are like the professional roadblocks, I would say, like from our side, what we face. Okay, so now coming to the next, that is the attitude. Okay, now some of us, because we feel like or let's say in a very defensive sense, we'll think like it is part of it. Okay, it's fine, I'll just have to say it like that. Okay, there is no sweet way of saying this. Okay, and while that is true, but let it not make you all tough and emotionless. Okay, that is, you think like, okay, I needn't do anything better. Like, oh, this is how it is. This is the reality. Okay, their emotions, they'll cry, yes, they'll feel sad, yes, that is also part of it. Okay, while that is part of it, while we may be seeing a lot of such people, for them this is the only thing. Yeah, very often I've seen how uh, patients would say like, that doctor just said it like that, the person had no compassion. The person just kept saying like that, he was so serious. Okay, he was so serious. Okay, so on the other side, we'll also hear doctors saying like, how I've seen so many cases, I've seen that. Okay, so while we may see a lot such people, we know that, okay, definitely they'll explode, maybe they'll shout, they'll cry, they'll yell. Okay, uh, all of that will happen. That is part of it. We know that, but for them, this is their only, they're talking about their own life, their own family member, everything, no? So to be sensitive to that and to know that, yes, what you say matters and the way you say matters, and there are ways to get better at it. Okay, all these barriers and roadblocks, there are ways to, let's say, manage these in a better manner. Okay, so that kind of attitudinal barriers, that is again from our side. Okay, now the other side, they'll also have some barriers. We'll go there. Okay, and the environmental setting. Okay, now these are not exhaustive lists. Okay, that is all of these points that will be like everything. No, all I'm trying to do is, we are just looking at different aspects of the whole picture. Okay, to show that it is not just one thing. Okay, it is not just the news that we have to say. It's not that the person is very old and, or let's say it's a small child, a small baby. Okay, so it becomes really bad. While all of those are factors, apart from that, you look at different aspects, different sides to the whole story, you'll see that there are a lot of things in play. Okay, one is our own barriers, and then we have the surrounding environment. Okay, like ideally, when we're sharing something like this or discussing about such a situation, such a condition, life-threatening condition, okay, you want it to be a peaceful place where there's privacy. Okay, maybe when you're talking to the person about this matter, you don't want, uh, let's say, loud music, or the festival kind of music going on in the background, or even as a ringtone. Ringtones, maybe sometimes they can be so jolly and happy and fun and everything, but here you have the person who's crying next to you, but that kind of sounds come from the background. Yeah, so ideally you'd expect that this happens in a very private, a peaceful space. Okay, but maybe that is not always there. This happens in between a lot of other things. Okay, a lot of other things. While on one side you're having this conversation, maybe on the other side someone else is, being happy about some small achievement that they made. Okay, so In that sense, the environment that will also pose a lot of challenges. Okay. And now coming to the so far, let's say we looked at what we might experience and what might be happening around us. Okay, now when you look at the patients and their families, the people on the other side, there are lots of barriers that will come from their side also. Okay, very often you will see that these people, they wouldn't want to know more about it. Okay, they wouldn't want to inform the person about the condition. Okay, because they are afraid that it will make the person feel even more worse. Okay, they'll be very protective, trying to say that everything will be okay, everything will be okay, don't worry, everything will be okay. They'll keep repeating that, no? So that itself will pose a big barrier when we are trying to show them, okay, how it is usually done or what happens usually. Okay, when they're blocking it, saying that no, that is not going to happen in our case. Okay, denial, a lot of denial. No, this will not happen to me. This cannot happen. Okay, they're afraid. And as a society, we are all afraid of death, right? We don't talk about death. Our loved ones we won't allow them to speak about death. We'll say, no, why are you saying about death right now? Death is always sort of dark and depressing thing that you should not talk until it happens. Yeah. So that kind of barriers, like where you're afraid to speak about death, even when it seems like it's so close to you, you'll try pushing it away, turning the other way around. Yeah. And especially when it is for your loved one, you'll try to protect that person from all of such thoughts. Okay. You don't think about that. Don't think about that. Yeah. So when a person is in that state, how can you talk about it? Yeah. So those are also like major challenges. Okay. And the social setting. Okay, it's not just the person, the family that you're talking to. Very often, again, in Pallium India, we have patients who come from very financially backward communities. They go through a lot of financial crisis. That is a person, maybe the only breadwinner, the person who is earning money for the family, they are the ones who get sick. So the whole family becomes, they're like, how do we manage all of this? And they'll have spent money for the treatment and then they're in debt. Okay, so there is that kind of a financial crisis, and very often they don't have support from other family members. We'll have mothers coming in with their children and saying that their father is not looking after them, or uh, an older mother or older father is there, and their children, they're not looking after them. They have just gone. They have their own lives right now. We don't call them. So there is a lot of isolation. They're all alone. They don't have that kind of a community support. So such factors, when apart from the whole condition, the physical condition, you have these factors around them that will also make it really challenging for us to help them. Help them in the sense to help them understand how to manage the whole situation, because they'll be really upset and in a very uh, vulnerable state. Okay, so these are like the barriers in general. Okay, like I said earlier, now there are lots of barriers. Okay, lots of barriers, but there is no point in me telling all of that. It is impossible to say all of that because for each person, their barriers may be very unique. Okay, but I want you to start looking at all of these angles. Okay, when you're interacting with people, when you're with the person, sharing a space with the person. Okay, there are lots of things that will make the communication very challenging with them. Okay, there are different aspects to it. That is the only reason why I showed these. Okay, that is when you're talking to a person, you look at yourself. Okay, is there something that is blocking me from talking to this person? Okay, and is there something in this whole space that is causing this tension? How is that person responding to what I'm saying? How is the person right now? What kind of state is the person in right now? Who is there with the person? Is the person all alone, or are they family members who are saying that no, don't listen to that, please? No, are they trying to block you out? Okay, so look at different aspects of the whole situation so that you understand, okay, how can I tackle this? How can I overcome this and communicate effectively? Yeah. Now I'm taking a small break, okay? Stopping this sharing right now just to look at you so that I can see your faces. Yeah. Now tell me so far, okay, what are your thoughts? Okay, we've spent about half an hour into the session. Okay. And I'd like to know what are your thoughts so far? Or let me put one question. Okay, we were talking about barriers in communication. Yeah. So as a common person, okay, not as a health professional, I'm sure we all have had times at the hospital seeing a doctor, at least for ourselves or for our dear ones. Okay. Have there been any situation where you felt like that doctor or that nurse or that health professional did not understand what you were going through, or they responded in a very insensitive manner, or any such experiences have you had? Let's do some sharing right now. Because one thing I've understood is like, for you to really understand what the other person is going through, you need to be able to place yourself in that situation. Okay, that is empathy. Okay, when you're able to look at a person's situation through their own perspective. Okay, not from where you're standing. That is not as a doctor, not as a nurse, not as a psychologist or anyone for that matter, but as the person who's suffering. Okay, so like that, I'd like all of you to take a moment, think about times where you have felt like the other person, that professional, health professional, did not understand you. And I'd encourage you to speak up, okay? Because reading the chat is quite challenging for me. And uh, just in between, because none of you are talking, it's hard for me to stop talking. I keep talking like this. That is one reason why I asked you to talk. Okay. So I'm a wheelchair user for the past 10 years. Following a spinal cord injury, I became wheelchair bound. Okay. So uh, one thing I always tell uh, whenever I get the chance to is my work in Pallium India, when I'm taking sessions for these people, my wheelchair is like my green card. Okay. My green card to be with them. Because when I'm on a wheelchair and I'm sitting amidst these people, for probably wheelchair users or cancer patients or their caregivers or any such conditions, okay, when I'm sitting with them, they'll start looking at me with compassion, okay, and they'll ask me, what happened to you? And then I would say, and then so how long has it been like this? And then they'll start showing so much of care, okay, and as they start speaking, they'll say okay, we are all suffering, okay, that is, they see me as a part of them, okay. So I always wonder, how would I have done this if I were not on a wheelchair, okay, because uh, when they see me, they just believe that, okay, I've been through a lot, that I've suffered, so I understand what they're going through, okay. And that also gives me the confidence to say statements like, yes, we've been through so much of pain and we really don't know what lies ahead. And it's really scary. Okay, when I say these things, I'm so confident because I know that they'll just believe me. Okay. So the reason why I said that is, now we can't expect everyone to, be through all of that suffering to actually empathize with the person. Empathy is possible otherwise also. Okay, that is when you start talking to the other person like you understand them. Okay, rather than judging them as, oh no, you should not think like that. No, this is not the right way to look at it. Okay, rather than judging them, when you try to understand them, it does make a lot of difference. Okay, so as a part of that, I'm again posing the earlier question. Okay, as patients, okay, if ever you have been patients or you have been with a loved one who was a patient, okay, how was your interaction with healthcare professionals? Is there anyone who would like to share some experience that they remember? ആര്യ ചാറ്റിൽ എന്തെങ്കിലും വന്നിട്ടുണ്ടെങ്കിൽ വായിച്ചു തരാമോ?
മാം ചാറ്റിൽ ഒന്നും വന്നിട്ടില്ല. There is nothing in the chat.
Okay. Yes. I can see only Arya and I'm sorry, I'm not able to see your name. I can only see videos of both of you. Others, no video, no audio. How will I understand if you're there? Thank you. Thank you for turning on your videos. Now, if you would be kind enough to speak up. Okay, now effective communication begins here in this session right now. Okay, now let's take it to the next level. Okay, that is, communication becomes effective when you know that other person has understood what you've said, rather than just saying something. Okay, when you make sure that the other person has better chances of understanding you. Okay, now let's just suppose I'm supposing that all of you are not Keralites over here. So imagine if I were speaking only in Malayalam. Okay, I'm giving a super session but fully in Malayalam. Okay, not bothering who my audience are, like, do they understand the language or anything. Okay, now in this session I used entirely English. Okay, so I'm not sure again if there were some of you who could not understand English properly. Okay, but effective communication, I mean, communication becomes effective when you know that the other person is able to understand you. Okay, or you're making way for that. Yeah, so now I'm desperate to understand how you're feeling, how so far, like I said, we have come so much in the session, and initially you didn't speak up, that is okay. But now please speak up. Tell me your thoughts about communication so far, what we have shared. Anyone? I can see you all smiling, and that's the big encouragement for me. But do tell me. I'd like to hear from.
Can I say something? Sorry, I
Of
couldn't
course,
on my camera.
that's totally
I'm
fine. Of
Jennifer.
course. Yeah.
Yeah, I don't know. I got some issue with my camera. Sorry for that. Okay. In my thoughts are to have effective communication. First of all, effect, active listening is important.
Yes.
I believe that
Yeah.
active listening and with empathy would
Mm.
be important element in effective communication, because that will lead us to have a effective communication. So listening skill, active listening skill, attentive listening skill is important.
Yes. 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 So, that is a wonderful point, Jennifer. And as we go forward, in the session, like what to do, how to communicate effectively, that is one of the most crucial things we'll see. About active listening. That is, before you speak, you need to listen. Yeah. That is very important. And it's not just about giving your ears, but also listening with your heart. Yeah, active listening and empathy. Thank you for that, Jennifer. Anyone else would like to share your thoughts?
Please unmute yourself and
Sorry.
please respond.
Uh, it's okay. I hope and I believe that they're listening actively. Okay.
Can I also add some more points?
Yes,
So
definitely.
I think building a good rapport with the patient would
Yeah.
also helps us to gain their trust, and therefore they would be open to share with us.
Yes.
So building the trust in first place, building the rapport with them
Yeah.
is important, so that they
Mm.
could be open to share with us.
Yeah.
But even if, let's say, they are not ready to share, I think we should allow the patient to have their space, have their time.
Yeah.
Being there, being present is good enough already, because sometimes they just want to vent out. They
Yes.
want to express their frustration or any concerns, but they 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 are not expecting any answer from us. So it's just for us to acknowledge the emotion, the expression of their feelings.
Yes. That is also a very important point. Sometimes it's not like we have a lot to say, but this whole through our actions, being with them, being present, like how Jennifer said, to show them that they're not alone. Okay, they're not alone. That is one important message that we give them. No matter what happens ahead, okay, we are going to support them. Okay, and sometimes that support is not by providing that kind of let's say medicine, or let's say social service support or anything, but it is about being with that person. Okay, as the person cries, to just be with that person, to show them that we are there to understand what they're going through. That becomes very important. And again, like that rapport building, very often in our uh, in Pallium India, the nurses are the ones who spend a lot of time with the patients. Yeah, so the patients or caregivers even, they have a better rapport with the nurses. So they might actually open out or tell their most secret thoughts to the nurses than a psychologist. Yeah, because at the night time when everyone is asleep, the nurse might be around, okay, taking care of their needs, and that is when the person feels like talking. Okay, so in that sense, that rapport building, having that connection with the person is very important. Yeah, thank you, thanks again. If there is anyone else who would like to add something, you can, or else we'll take this forward. Yeah, let me just share the screen once more. Um, just a moment. Okay, so these were the barriers. And now, what I want all of you to know is communication skills can be learned. Okay, that is, now as we move to the how part, like how can we communicate effectively? Okay, even when we are discussing very serious news, it is not easy. It is easy to listen to what we say, but even then, or let's say it's not easy for us to even see how much the person is troubled by what we say. Okay, even in such situations, amidst all those barriers that we looked at, okay, communication skills can be developed, it can be nurtured, and you can actually feel like, yes, I'm doing this better. You will get that feeling. So uh, it's not just about what you say, like I said before, it's the way you say it. And by the way you say it, it's your tone, okay, the kind of emotion you put into it, okay, the way you present yourself, okay, that is your body language as you're with these people. How are you spending time with them? How are you using that space? Okay, all of that becomes very important. So you watch the way you say it by not just choosing the words that you say, while that is important, along with the words, the emotion that you put into those words. Okay, that becomes very important. So now you'll look at distancing behaviors. Okay, not ideal. Distancing behaviors are like you're not getting close to them. Okay, you're just blocking yourself from them. So I've put these images to just depict that. Okay, that is, you're not having eye contact. Okay, when you talk to a person, even if it is to look into the pain that you see in the person's eyes. Okay, to have that eye contact is very important, because it is only through that eye contact you can actually show them that, yes, I see you, I understand you. So eye contact becomes very important. Okay, but if you're looking at some other place, okay, it's really hard to see the other person. The other person is angry or sad or confused. Okay, so naturally we'll like to look somewhere else. Okay, but when you're doing that, when you're looking somewhere else, you're actually telling the patient that, sorry, I don't want to be a part of what you're going. I don't, I'm not comfortable with that. Okay, that is the message you give them. So eye contact becomes important. And if you're, if you're not giving your face to them, yeah, you're covering your face, hiding your face, looking in the other direction. Okay, that is again like you look into the you look at the person, you're with them. Okay, your face is directed towards them. Okay, I mean, just think about intimate relationships. Okay, when you're with a very person whom you're very close with, okay, close, emotionally attached to. Yeah, how do you carry yourself with that person. You'll be in close proximity. Yeah, you'll be looking at the person. You'd like to look at their faces. Yeah, you'd have good eye contact. Okay, and when you speak, your voice is audible. Okay, it is not all hushed, and you're not covering up your face or anything. Body language, it becomes very important in general settings also. You keep your mouth covering, it shows like, okay, the person is not interested and things like that. Okay, so keeping yourself open, okay, that becomes very, it's like through your body language, you're showing the other person that I am here for you. Okay, and keeping an open posture means, rather than showing that kind of an authoritative, you fold your hands, you keep it crossed. Okay, or you're like, I'm the doctor, you're the patient. Okay, that is there between us. Okay, all of those small things that you may actually ignore, it conveys a lot. Okay, but instead of that, let's say the doctor sits next to the patient, or the whoever, the health professional, you sit next to the person at the same level. That is communicating to them that I'm here with you. I'm here with you. And above all, okay, more than blocking anything else, I would say, if you block your heart out, that is a big no. Okay, that's like a huge distance between you and your patient. Okay, patient or family caregiver, okay, who's the recipient of your care. Okay, if you block your heart out, when I say blocking your heart out, what does it mean? That is, now this is very painful, right? When you uh, get to know about such situations or even death, it's very painful. So naturally we'll try to block it out. Okay, or we'll have our own worries and things to take care of, and so you don't want to get involved in that. Okay, and you think that, okay, everyone goes through this. I've seen a lot of cancer patients, I've seen so many people like this is like the protocol. Okay, so you're blocking your heart out there. Like I said before, for them you are the only one. Okay, for them this is their life, this is their loved one. Okay, for us it is, okay, it is this person, this patient, this caregiver, we have another person to go to after this. But for them it's not like that. Whatever you say, how much time you spend with them, after that they're going to stay with that. Okay, so blocking your heart out, that is like the biggest mistake that can happen. So keep your heart open. Okay, be pain, maybe they'll get angry, they'll say rude things and all, but maybe you're the only one who'll actually listen to them. Everyone around them might blame them, or say a lot of other things. Maybe you are the only person who'll actually be with them in a very supportive manner. So that kind of distancing behaviors, watch out for that. Okay. Now, when you change these, when you, instead of closing yourself up or covering yourself up, okay, when you keep yourself up open, that is one step towards effective communication. Okay. So this is again what we discussed earlier. Okay, when it comes to eye contact, having a poor eye contact, okay, and when you're covering up your face, you're all serious, you're not showing that kind of a compassion in your face. Okay, the voice that you use when it's all serious and authoritative, like, I'm the doctor, you listen to what I'm saying. Okay, in that sense, I'm not saying any of you are like that. I'm just telling you, these are the small things that actually make a big difference. Okay, and your body language. Oh, what is negative body language? Negative body language is, like I said earlier, you're closing yourself up, you're turning in the other direction rather than facing the person you're talking to. Okay, you're keeping yourself closed, guarded, you're looking somewhere else. All of that is like a negative posture. But instead of that, you look at the person, you lean towards the person, you show attention and interest in the person. All those are positive things. Okay, so in that sense, when you give your attention to the person, when you give your when you show that you have interest in the person, that helps your communication. Those are the non-verbal aspects. Okay, not what you're saying, but how and the things that go along with what you're saying. Okay, and apart from this, okay, these are just some other examples for distancing behaviors. That is, whenever a person says something, okay, make sure, as a rule of thumb, okay, respond to their emotion first. Okay, not the logical aspect or factual aspect of it, but their emotion. Okay, like in this particular example, the patient is saying, "Doctor, I'm so worried. I can't sleep. I'm having back pain." Okay, so the doctor in this example says, "Tell me about your pain." Okay, maybe because the doctor can do something about the pain. Okay, that is why. Good intentions, but what is happening? The worry, can't sleep, all of that is getting ignored. You're looking just at the pain, the physical symptom of it. Yeah. So respond to the emotion first. I'm feeling so worried. Okay. So you respond to that saying that, oh, I understand that you have a lot of worries. Okay, would you like to tell me more about it? Okay, what is stopping you from having good sleep? Okay, in that sense, you explore more. You respond to the emotion first. You make the person know, understand that yes, I heard you. I heard you. You're feeling so worried. Tell me more about it. Okay, what is causing you worry? In that sense, you're responding to that. Yes, the pain is there, but you respond to the emotion first. Okay, and very often even patients may say very logical things like, okay, I, I cannot do this. All my money is gone. Okay, my family has left me. Things like that they'll say. Those are like clear points. Okay, my family has left me. I don't have money. Okay, you can note down all those problems, no? But what is this making the person? Person is feeling really upset. Okay, so you ask, okay, how are you feeling about that? You must be feeling alone. You're feeling scared, terrible. Okay, in that sense, you respond to the feelings that come along with that. Okay, in that sense, respond to the emotion first. Okay, that's a rule. I don't want any of you to forget. Respond to the emotion first, and this works even in general settings. Okay, like apart from palliative care, when you spend time with people and they share things, if you respond to the emotion first, you may actually have a more meaningful conversation with them. Okay, and other examples for distancing behaviors, one is philosophizing. Okay, that is, you start talking about your life. No, life is like this. It's meaningless. Okay, there is no point in life. You say things like that. No, so you don't respond philosophically to that. Okay, you can ask questions. Okay, what is making you feel so? Would you like to talk more about that? Okay, rather than saying that, yeah, life is really challenging. Life is bad. Okay, life is very cruel. You say things like that, no? Rather than that, you ask them to explain what they are saying. Okay, when they are saying my life is meaningless, or uh, it's fully upside down. Okay, rather than assuming that, okay, you understand what that means, you can ask, okay, can you tell me more about that? Okay, so again, you're giving them your attention. If not nothing, you're giving them the space to just share whatever is in their mind. Okay, you're not trying to correct their thoughts. You're not right, trying to show them that no, you should not think like that. See, there are good things happening in your life. No, you're not trying any of that. You're just giving them the space to share what they're feeling. Okay, what they're going through. And then the next thing that you need to be careful is moralize. Now, uh, I'll have to admit that sometimes this has happened in the back of my mind. Okay, so there was this patient who had uh, I don't remember the condition, but yeah, something to do with myeloma. Okay, but he was struggling a lot. Okay, but after long months of conversation, finally I get to talk to his wife, and she tells me that he had done a lot of bad things. Okay, in his young age, things like that. Okay, so then suddenly I'm thinking, oh, okay. So he had done all of those things, huh? In that sense, I'm thinking, okay, no, I didn't say anything like that to him, okay? But automatically that thought came into my mind, okay? Oh, he did bad things in his life. Okay, in that sense, I'm thinking. So that happens, okay? That can happen. But when that happens, you watch yourself. Oh, you had such a thought, but let it not come out of your mouth. Okay, you are in no way a judge. You have no right to judge anyone else. We all do things, mistakes. We all make mistakes, yeah? But that doesn't mean we should suffer because of what we did. No, in no way can we judge a person. Okay, you cannot take that position and say that, oh, see, you have done so many things, or You've smoked a lot and that is why you're here. You've drank a lot of alcohol, that is why you're here. No, that is not what the person wants to hear. I mean, a lot of people would be saying that to the person, right? Yeah. So you don't want to be that person. Instead, you be the person who listens to them. Okay. That is what they're going through. What is it that they're feeling? Yeah. And coming to leading questions, okay, leading questions are like you want them to say something. You gave them medicine, okay, especially for sleep disturbances. Medicines have been given, so you ask them, now your sleep is better, huh? We've given you medicine, no, so it must be better right now. So you're asking them a yes or no question. Okay, it is better, right? That is how you're asking. No, don't do that. You ask open-ended questions, and that is what we're coming to next. Okay. Open-ended comes later on. Yeah, open-ended questions, yes, it will come later on, but it's not like yes or no questions. You're leaving it open. How's your sleep these days? Rather than asking, your sleep is better, right? Rather than doing that, you ask, how's your sleep? Okay. In that sense, in order to just get it done with, you might take shortcuts, but don't take shortcuts. You listen to the person. When you're with the person, you make sure that the time is for that person. Okay. And uh, stop trying to make it any lighter than what it is. Okay, being pleasant is different. Okay, being patient is different. But to crack jokes, okay, about anything they're going through, okay, that might be very insensitive depending on where they are. Now, I do crack jokes sometimes, okay, especially with elderly people. If they're looking good after a nice bath and everything, I would say, you look handsome. I'll say things like that. Okay, and then I'll see them grin, okay, without any teeth, they'll grin, and that is very sweet to see. But you need to be very careful when you crack jokes. You need to understand where they are right now, okay, so that it does not sound insensitive. Yeah. So in that sense, there are a lot of things that you need to watch yourself for. Okay, how am I behaving? Is this in any way making them feel worse? Am I just distancing them away from me? Things like that. Okay. So these are just examples for that. Okay, let me just check. If you have any questions, like I said before, do ask. Okay. So now we looked at distancing behaviors. Now let's look at what should we do. How is it that we can actually counter these tendencies? Okay, these are like natural tendencies that we may have. How can we counter them? How can we go around them? Yeah. Let's look at the non-verbal thing first. That is a body position. Okay, you show interest in that person. How do you show that? You look at the person. You begin with your face, you look at the person. You give them eye contact. You look into the person's eyes. Okay. You look at them. You lean forward. Okay. Rather than, staying away, like you have a position and they are there, I'm here. No, you get close to them, okay, depending on whatever proximity is comfortable, and it's fine depending on that. Okay, not that you need to hug them and hold them close, no, that is not what I'm saying. Whatever works right then. Okay, but you show interest in the person and you lean in, you look at them, okay, and you sit along with them. Okay, you go to their level. Yeah. All these are like, you're giving a positive impression, positive feeling. That is what they get when you show interest in them, you look at them. Okay. And like I said earlier, when you're holding yourself back, okay, when you're blocking your face, when you're blocking your eyes, when you're blocking yourself, and you're blocking your heart, all of that is like a big no. Okay, that will bring distance between both of you. So in order to cover that distance, you keep yourself open. Okay, you show that yes, you're here, I'm here for you. Okay. And touch. Okay, some word got shifted in the slide, but touch now. Touch is very important. Okay, now a personal experience would be, there was a mother of a man who met with a severe accident and his brain got injured. Okay, so initially when I was speaking to her, the man was in an not in a responding state. Okay, yes, he was being supported, but was not responding verbally. Okay, and there was minimal movement. Okay, so the mother's context over here is uh, her husband had left her years back. Okay, and physically she is also very tired and weak. Okay, but she is with the son. Okay, it's a male adult, so lifting him and taking care of him is also physically challenging for her, but she's with him, and financially they're struggling. Okay, they don't have any other means of support, so she's in a very vulnerable state, and she's as I'm talking to her, her eyes are filled. Okay, she's all teary, and she's saying how she has struggled all her life, and she has managed everything. She has come until this point. Okay, that is, she's in a way, even though she's sad, she's talking about her strength. Okay, and that day all I managed to do was I asked her, can I hold your hands? Okay, and I held her hands, and then I just repeated the things that she said. Okay, about how she has come forward so much, of how she has managed everything, and even up till this moment, that is the same thing that she's doing, that she has not given up. Okay, I just held her hands as I did this. Okay, and I believe that was like the starting point, because that mother really loves me a lot. Every time she sees me, she comes close to me and hugs me, and she says that you are a good person. She always tells me. Okay, so that day, just holding her hands like that, uh, I believe that it really reassured her and comforted her. So a touch can speak a lot more words than you can ever imagine. Okay, and like what I said earlier, open-ended questions. Okay, open-ended questions usually begin with what. Okay, what are you feeling? Okay, what is causing all of this worry? Okay, things like what and how. Okay, rather than asking like why. Okay, why is like questioning. Okay, ask what. Okay, what is going through your mind? What are you feeling right now? What is scaring you? Okay, what is causing you pain? Apart from physical pain, there are lots of other reasons for pain. Okay, so open-ended questions are like it's like a descriptive answer. Okay, like in school we used to have these short answer questions where it would be like uh you'll know, right, when you see the question, it's like yes or no question, not a one word answer. So go for the essay question. Okay, where they'll get to describe what they're feeling. Okay, like I said earlier, are you sleeping well? Okay, that is like a short answer question. Yes or no can be the answer. So, how was your sleep? That is like a long answer question. Okay, so are you, is this, does that? All of that becomes yes or no questions or one word. So, avoid such questions, because it can lead to a lot of assumptions. Okay, when you ask, did you sleep well? The person may bluntly say no or yes. Okay, and then again you'll have to pose other questions, and then it becomes like an interrogation. So keep the questions open ended. That will give you more chance to understand what the person is going through, and it will give the other person chance to explain themselves more. Okay, so these are like again examples for closed ended questions, like do you have pain? Where is the pain? Is it continuous? Do you vomit? All of the, like, do you, where, and are you, is, and everything, all of that tends to give you very closed ended questions. Okay, yes, and like Jennifer said earlier, active listening. Okay, now what is active listening? The reason why it's called active listening is because people tend to misunderstand listening as a passive activity. Now, passive is like an inactive. Okay, you're just listening, you're just sitting there and listening. No, but listening is it can be a very active process. Okay, and how do you make it active? Okay, listening is not just where you sit silently and you hear what the other person says, but as the other person speaks, you look at them, like the earlier points that we covered. Okay, you look at them, look at their eyes. Okay, you nod your head or shake your head. Okay, you express. Okay, if they're talking about pain or anger, you show that expression in your face. Or if they said something sweet in their memory, you smile along with that. So you're mirroring. Okay, you're like a mirror, you're showing them how they're feeling. Okay, and in between you'll repeat what they said. Oh, you felt like that. Oh, you must have felt sad. or oh, that must have been terrible. That is, you're repeating what you're showing them that yes, I'm listening. Yes, I'm listening. Yes, that in that sense, like if this virtual session could be more active, or not virtually, it might be very disturbing, but in a physical setting, as I speak, many of you may be nodding your heads, or you might say something. Yeah, so in all that sense, I'll know that yes, you're all listening actively. Yeah, in that sense, you show the other person that yes, I am listening. Okay, you nod your head, you show those gestures, and you speak, and at the end you say that, oh yes, so this happened, and then you ended up feeling this way, or this is causing so much of pain, and I see that. So you're summarizing what they said, so they know that okay, she listened everything, he listened everything. Okay, that is why it is called active listening, as opposed to people thinking that listening is a very inactive process. Okay, listening can be very active, and that makes the whole difference. Okay. Yes, and finally, coming to empathy. Empathy is something I love. Okay, a word that I really love, especially when it's put into action. It's great. Okay, so here's acronym that I want you to remember in connection with empathy, and that is nurse. Okay, think of the most wonderful nurse that you've seen in your life. Okay, just uh, think of that person as you try to remember this. So over here, each of these letters, okay, it has a, let's say, a word attached to it. That is, N is for naming, U is for understanding, R for respecting, S for supporting, and E for exploring. Okay, now this is the model that you can use for responding, or having conversations with people who are going through this in palliative care. Okay, now naming. What do we mean by naming? Naming is you put a name, a label for what they're experiencing. Okay, now this is not like you're judging. Okay, but when a person says something really terrible, or person is expressing their fear, you say that I understand that you're feeling very afraid. Okay, you must be feeling so scared. Okay, that must be terrible news for you. Okay, or when the person is saying that family has left them, okay, you might be feeling so lonely. So what am I doing? I'm using these words, I'm naming those feelings that they're having. Yeah, and that might open up more discussion. Like they might say that no, I'm not feeling lonely, but I'm just feeling betrayed. Okay, they might say more. Again, that is also a good thing. But otherwise, let's say they are agreeing with what you said. Yes, I'm feeling so scared. Okay, so in that sense, you name it. Okay, that is in one way showing that yes, you understand. Yeah, and that is the next point, understanding. Okay, that is crucial. Okay, in empathy, one thing is for the other person to know that you understand them. Okay, and the golden phrase is, I understand what you're going through. Okay, sometimes even when you don't understand, saying that would make the other person feel better. But no, don't. Uh, that does not mean that you just simply say that. Genuine, being very honest is very important. Okay, so telling them that yes, I see that you've been feeling all this, and it is such a tough situation for you. I'm able to understand what you're going through. So when you're talking to them, telling them that yes, I understand, and what have you understood? Say that also. Okay, so they'll know that yes, you've understood. Okay, or else if you simply say I understand, they might ask, what have you understood? Okay, they might ask. So be sure that you know what you're talking about. Okay, but it is very important. Uh, if not anything, sometimes when people feel like the other person has understood them, that itself is a great comfort. And I'm sure that you all have experienced that in one or the other way, and you felt understood by someone. That is really comforting, right? Now coming to R, that is respecting. Okay. Now, in the earlier example, when I said of that mother whose son was had brain injury, okay. Now, she was telling about how many challenges she has overcome, and she's come until this point in her life. So, in a way, I showed respect to her that you've come so much. You're such a strong lady. Okay, that is, I'm showing respect for her character, what she has done. Okay, so that's like it makes other person feel really good. Okay, even when you're going through tough times, to say something like, you're such a strong man, you're such a strong-willed man, you have never given up. Okay, I respect you for that. Okay, that can actually encourage them, because they'll feel like I'm being seen. Okay, someone has seen that, someone has heard that. Okay, so saying that, yes, I respect you. Okay, that also helps. Now, S is supporting, and that is like a team thing. Okay, and especially the work in Pallium India, I feel thankful because we have a whole team over there. Like, when I'm talking to this person, the person is talking about financial struggles and things. I know that, okay, there is a social work team whom I can approach, or the social work team who will try to help that area. Yeah, in that sense, that we are supporting them. Okay, that is for our comfort, that okay, we have the team to support us, but for them, to tell them that, okay, we are with you. Okay, we are sharing a really serious news, of sad news with them. And then when they are really upset and feeling like uh, there is nothing to do, to tell them that we are with you in this, we shall support you. Okay, that is like, it's not just about saying, but when they see that you're supporting, like in Pallium, again over there, when people get admitted over there. Okay, uh, and they really get taken care of, and I tell them that we are with you, we'll definitely support you, then they nod their heads. Yes, yes, we know that. Okay, so that makes a lot of difference, that we are supported. Okay, we are there to support them. Yeah. And finally, exploring. Now, this is connected to something that I said earlier, that is with open-ended questions. Okay, that is when they say something, rather than just agreeing to it or trying to correct it, you ask them, okay, what's making you feel that way? Okay, my life is a waste. I've wasted my life. Okay, so then first you respond to the emotion. Okay, you say that, oh, it might be such challenging feeling, or it might be really troubling to think that way about your life. But tell me, what is making you feel that way? Yeah. So you're responding to the emotion first, and then you're asking them about it. What is it? What is it that they'd like to tell about it? And then they might explain that. Yeah. So these are like, so that is where I said, remember the nurse. Okay. When you talk to them, try to uh, respond using these models. Okay. That is, you name what they're going through. That is, put a name for their whatever they're expressing. Okay. And even if, let's say, you go wrong, give them the chance to correct that. Is that how you're feeling? Okay. Or how is it that you're feeling? Okay, you ask them. And then you show that you understand. Yes, you understand. And respect them. Okay. If you really look hard, you'll find reasons to respect a lot of people around you. It's not just about calling them sir, ma'am, or anything, but to respect their character, what they have done, okay, things like that. So show them that you respect them, and remind them that you're there to support them, and let them talk more, explore, rather than you talking. Okay, listen to them, ask them questions so that they can give you those essay answers. Yeah. So coming towards the end, now this is another quote that I found interesting. It is talking about communication. Okay, if we do it badly, they may never forgive us. And if we do it well, they'll never forget us. Okay. So that is, I think that is very important. Okay. Now, for me, initially, when I became spinal cord injured, uh, I remember some doctors saying, we can't give you false hope. We can't, I don't remember anything else that doctor said, but all I remember is false hope, false hope. And at that point, I didn't like that. And even today, I think there were better ways to say that. Okay, I've not forgotten that. Okay, but at the same time, I've also had nurses, who were so caring and loving, that it made me curious, like, how are you able to do this? And then she said, I really love doing this, I really love caring for people. And I remember that. Okay, so in that sense, uh, either they'll never forgive you, or they'll never forget you. So you choose which you want. Yeah, with that, we come to the end, and now it's discussion time. So tell me if you have something to ask, share.
Thank you, Nincy, for the wonderful presentation. Anybody have any doubts? Any comments or anything? Anybody? No. So I hope your presentation is clear to everyone. Okay. So time up. We have 8 minutes more. Anyway, before concluding this session, I would like to highlight few things because, as Nancy said, nurses are spending more time with the patient. So we can able to explore more problems. If we need to explore their psychosocial issues, we need a good communication skills. So the first part of the thing is the communication is be a good listener. So that is also one of the important part. And all other things, eye contact, tone of voice, these all things are very important because if you take that communication skills, like the ways to communicate a problem with others, we have a verbal communication, we have electronic medium, we have a non-verbal communication. So from that, we are using more non-verbal language for communicating any for communication to other person. So the thing is, the one important thing is you have to keep it in mind is our non-verbal expressions will not harm the patient emotionally. So that is very, very important. So if you think in anything in your mind, that expressions comes to your face. So that other persons can understand from your face, and also the tone of voice. So they will not forget the tone of voice and that expression, and also the non-verbal communication is uh, very, very important. We are using more non-communications that things. So while we communicate, you have to keep it in mind. These non-verbal communication not give an emotional harm to the patient. Others thing is also important. As Nancy said, don't assume, don't that give a false hope, don't give a premature reassurance. These all are very, very important. Do one thing, be a good listener, and if you get something from the patients, definitely you have to convey with the team. So teamwork is very, very important. If you for example, psychosocial issues. So we all are focusing on the physical aspects. The other important part is also that social, emotional, and spiritual. That is also important. So we learned about the total pain concept. So the psychosocial issues also, if there is any psychosocial issues, we have to give a that special attention to that area. If you find out the patient is having some psychosocial issues, definitely you have to that convey with the team. Psychologist can do a more exploration. So if we can able to explore many things, definitely we can do many things for the patient. So this is very, very important. So be a good listener, and always you have to keep it in mind the non-verbal that communication things also while we communicate with the patient. Okay. Thank you, Nancy. Can we wind up I think time up.
Yeah.
We can wind up.
Thank you so much.
Okay, so thank you. So over to you, Arya.
And Nincy ma'am, it was such a wonderful session. Thank you for that. Thank you, my dear participants. And thank you, Sister Sheba, for the facilitation. Thank you. We will see you in the next session. Thank you. Till then, bye.